Well, thank you so much. Thank you so much for the invite to Melissa and to Christine. My name is Karen Reisdorf, and as Christine mentioned, I'm a diabetes educator. So I teach a lot of people how to live well with diabetes. That's what I did in the first part of my career, and now I currently work for a pharmaceutical company as a diabetes educator. So I'm able to go out and teach physicians and nursing staff, and even sometimes patients about diabetes and the newer therapies and how to see if we can help get more patients to goal, because you know that is the key, isn't it? If you live with diabetes or if you know someone that has diabetes, they're always working hard to get their numbers, to get their where they need to be so that they live well with diabetes. So before we get started, I would just like a show of hands, and you certainly don't have to admit anything, but do you have diabetes, or do you know somebody, friend, neighbor, someone from church, someone you work with, person down the street that lives with diabetes? Anybody know anybody that has diabetes? Okay, pretty much everybody. If I walk into any room anywhere, if you walk into any room anywhere, people will say, yep, I know someone who has diabetes, or I live with it myself. Okay? So I thought what we would do today is I would tell you the story of diabetes. Many of you probably know a fair amount even about diabetes, but there's always a few myths that go along with some of the knowledge that people have about diabetes. So we want to clear that up and make sure that you know what's myth and what's fact, what's fiction, and what's truth, so that you can move forward well. So this is called, as I said, whoops. Let's see, are we searching again? Hang on just a second. This is the audio-visual glitch. There we go. Okay. Shouldn't be searching for too much longer. Okay, there we go. All right. So this is Diabetes Management, Diabetes 101. As we look at diabetes, I'm going to use some props. You all ate lunch, and so I know that you're well rested. So my goal for the next 45 minutes is to keep you awake and engaged, because I know what happens after lunch. And so we're going to talk a little bit about diabetes. And certainly if you are one that raised your hand that you have diabetes, you are not alone. 1 out of every 11 people in this country have diabetes. That's more than 30 million Americans. Did you know that this is becoming somewhat of an epidemic in this country? Back in 1980, we had about 5 million patients with diabetes. 1980. Now that's within all of our lifetimes, right? Today, we have more than 30 million people that live with diabetes. And of that 30 million, about 90 to 95%, or just most everybody, has type 2 diabetes. Okay? The most common type is type 2, and we'll talk a little bit about that. But that is on the increase. And it's expected that within the next 25 years, we're going to see the incidence of diabetes double in this country. What that means to all of us and to our healthcare dollar is that a lot of money is going to be shifted or filtered over to managing diabetes. So our goal as diabetes educators is to help people with diabetes to live their life as healthfully as they can. And what does that mean, and what does that look like? We're going to talk about that. Okay, so you understand that clearly, and then I'll leave some time at the end for questions, because everybody always has questions, right? Okay, so lots of folks have diabetes in this country. When we talk about the diabetes team, it really begins with you as the person who lives with this. You've got all kinds of people that help support you and provide you with education and information. You maybe go see an ophthalmologist once a year to get your eyes looked at. There's all kinds of people in that circle, that team, but you are the most important, because if you have diabetes, you are the one that has to do those tasks and put one foot in front of the other every day. Take your medicine, take it at the right times, eat well, follow a food plan of some sort, get some physical activity, and check your blood sugars. So there's a lot of things that we ask you to do every day to help manage your diabetes and live well. I liken it to juggling. Watch me. So I'm newly diagnosed with type 2 diabetes, and not a big deal. My doctor gave me this pill. It's called metformin, if that's familiar to any of you. So it's pretty easy, and he said, just watch your sugar, Karen. So I'm thinking, hey, this is a piece of cake. It's pretty easy. I go back, and he says, your blood sugars aren't down. We need to do more. So now he sends me to an educator, and I have to learn how to check my blood sugar and check my blood sugar several times a day. And I might have to go on another medication, which you inject, which is going to help me, but it's more to do, right? And then I have to go see a dietitian, and she teaches me how to eat well and how to count my carbohydrates, and now watch me. Oh, and I have to be on an exercise plan because, I have a little weight to lose. So now I'm juggling faster and faster. There's more tasks to do. Now, that's not a bad thing because all those tasks help you to live healthy. And that's the name of the game because you're all worth it, right? You're all worth it. It's important to live well so that you don't have the changes or the complications that can happen when your blood sugars are really high and uncontrolled. So we think it's really important to teach you so that everybody understands what it takes to live well with this disease, okay? So that diabetes team begins with you, and I thought we would just get back to our basics and start with the apple. So when I do this, and I take a big bite of that apple, what happens?
You chew a while.
She's right, you chew a while. But what happens to me inside, if you look at the picture of the man, what happens is that apple starts to go through the process of digestion. And because it's a carbohydrate, carbohydrates are starchy foods and sugary foods, including fruits and milk. Those foods change to sugar in the body. Not a bad thing, that's just what happens, okay? That sugar, or glucose is what it's called, is what we as human beings use for energy, for fuel, so that you can get up in the morning, that you can come to this talk, that you can drive down the road, go get groceries, rake the lawn in a few months, shovel the snow. Anything that you need to do requires glucose for fuel. So carbohydrates are really necessary in your diet. They also have the effect of raising your blood sugar, okay? Raising your blood sugar. So carbohydrates make blood sugar go up, and insulin, a hormone that's made by your pancreas, that little gland that has the arrow pointing to it behind the stomach, brings your blood sugar down. In people who don't have diabetes, this is a perfectly working system. Everything works great. Blood sugars don't go up too high. Blood sugars don't go down too low. When you have diabetes, I threw it all out the window, okay? It no longer works like that. So what happens when you have diabetes? The pancreas makes little or no insulin. Remember, the pancreas is the gland behind the stomach, and that's secreting insulin. That's a hormone that lowers your blood sugar. So if you don't have enough insulin, or if what you've got isn't working as well as it should, blood sugars go up, okay? High blood sugar, if you ever heard this term, is called high glycemia, sugar in the blood. High sugar in the blood, okay? Hyperglycemia. We actually have a couple handouts over there if you got those, one for high blood sugar and one for low blood sugar. So blood sugar gets too high. We talked a little bit earlier about the different kinds of diabetes. The red bar is the most common. Okay, type 2 diabetes, where you're not making enough insulin or what you've got is not working properly. Okay, so there are other types of diabetes. There's a type 1 diabetes, which is less common, and that's the type that young children or young adults get, although you can get it at any age. I remember working with a 65-year-old woman in the clinic who just developed type 1 diabetes, and she was hopping mad because she thought you only got that when you were less than 10 years old. No, it can happen at any time. And then gestational diabetes is diabetes that occurs with a woman when she is pregnant, okay? And for that type of diabetes, you have a higher risk when you get older of developing type 2, okay? The kind in the red. So we talk a little bit about diabetes risk factors. What, if anything, puts me at risk for diabetes? How does this happen? There are some things that cause you to have a greater risk for diabetes, and those are things that can either be changed or not. You can't change your age. You've all aged very gracefully. You look wonderful. Age you can't change. You can't change your family history. If you have a strong family history of diabetes, you may be more likely to develop it. You can't change your race or ethnicity. People that are of Hispanic origin or African Americans or Native Americans have a higher incidence of diabetes than Caucasians. If you have a history of heart disease, if you have had diabetes during pregnancy, as I said, the ones on the left that you can change, take a look at those. Physical inactivity, being overweight or struggling with your weight, having high blood pressure, your cholesterol levels. You know, if your provider, if your doctor has prescribed a statin or a high blood pressure drug for your blood pressure or your cholesterol levels, it's really important that you take that because that's important to lower your risk. If you can get daily physical activity, we talk about that. We don't ever say the E word anymore. Do you know that? Yeah, we don't talk about the E word anymore. Physical activity. We can all do that. And then also just shaving a few pounds off over time. So that just means maybe, you know, skipping the dessert or choosing some fresh fruit instead of something that's a little more caloric. You know, small, little, tiny changes to help you lose maybe 5 or 10% of your body weight. So those are risk factors that you can change. Well, how would you know then if you actually had diabetes? What would that look like? You can go to the doctor, and there's a number of tests that they can do that will confirm that you actually have diabetes. A little note about prediabetes on the right-hand side. You know, sometimes people are told that they have prediabetes. You know, they're not diagnosed, but your doctor might say, you know, you're getting up there. That means that your numbers aren't quite in that category of saying, yes, Matilda, you have diabetes. They're one step before. So I tell patients it's kind of like you've got a foot in both camps. It's not 100% normal blood sugars, 70 to 100, but it's not over here at diabetes yet. So that's where you can really do some things to help yourself by eating healthfully, losing a little bit of weight, becoming physically active to bring that number down, okay? And that is possible. We talk a little bit about some symptoms of diabetes. Have any of you ever experienced any of this, or do you know family members that when their blood sugars are high, they're really thirsty, or they go to the bathroom all the time, or they maybe have cuts or bruises that take a long time to heal? These are some of the symptoms of high blood sugar or hyperglycemia. Did you know that if you go into the hospital for surgery and your blood sugars aren't controlled well, they may delay or they will delay your surgery? They want you to have the best chance possible for recovery and adequate healing. So when your blood sugars are high, there's so much sugar there that that's a good medium for bacteria. You have more issue with infection when you're not well controlled. So it just makes sense that you would work towards that good control so that you can lower your risk. So these are some of the symptoms of diabetes. Sometimes when blood sugars are really high, people will feel more tired. They just want to go take a nap, or they're a little more irritable. So I always used to use this when I was in clinic in practice, and I would turn to the spouse and say, so how does John behave when his blood sugars are high? And I wouldn't let John answer because he doesn't think he's irritable. But his wife, or vice versa, would always say they're really crabby. So perhaps that's a time you should check the blood sugar and get a hold of your provider, your doctor. All right, so how do we then stay healthy with diabetes? How do we do it? What do we do? Where do we start? First things first, you would want to look at setting your blood sugar goals. Where should I be? Where should I be? If you are not familiar with the first test, that A1C, I did leave a little brochure for you. That's a test that's kind of like memory. It's a memory test. It looks back at the previous 3 months, and it's expressed as a percentage. So the higher your blood sugars have been, the higher your A1C will be, okay? So the goal for many people is to be less than 7 or less than 8%. How about blood sugars? You know, when you think about poking your finger and checking your blood sugar, that goal, and these are from the American Diabetes Association, so they're valid goals. These aren't just goals that Karen dreamed up. 80 to 130 before you eat. So think about that, 80 to 130 before you start eating, and then what happens to you after you eat a meal? Does the blood sugar go up or down? It goes up. So that's why it says 1 to 2 hours after the start of a meal, you should be less than about 180. So it's giving you some room to go up a little bit because that's a normal event. But it's not saying that you should go up to 300. So up to 180, okay? All right. Before we go on, I just want to do a kind of a check-in. Do you remember when I talked about the hormone that helps to lower blood sugar? So this is going to be a multiple guess. Is it progesterone? Is it serotonin? Or is it insulin? All together, good. Okay, nobody's sleeping yet. So checking your blood sugar is also important, and you may need to check it at certain times. Many times the recommendation is to check before you eat, so before meals or snacks, or perhaps at bedtime. Another time of day when you can really see the effect of the meal is 1 or 2 hours after you have eaten. Because what will that show you? Remember, it goes how high you go, right? Because remember, it goes up after you eat. So that's about the time that you'll see the highest point before it begins to start coming down, okay? And then, of course, whenever you feel like you might be hypoglycemic or have a low blood sugar, you should check your blood sugar to confirm that, okay? So that's the next thing we're going to talk about, low blood sugar. This can happen if you're taking medication that lowers your blood sugar or insulin. Not all medications that lower your blood sugar will cause you to become hypoglycemic, but insulin certainly will. It's the #1 side effect, even though insulin is fabulous to control your blood sugar. So I always tell patients you should know what to do, right? If you know what to do, you're perfectly fine. If it happens, you know what to do. So again, with low blood sugar, these are some of the symptoms that you might feel, weak or tired or hungry. It might happen if you skip a meal. Don't want to do that, right? It might happen if sometimes patients will forget and take their medication twice. That's also not good. That's why some of those little pill holders or something that you can write on some type of reminder that you took your medicine would be good. Being sick. Sometimes if you drink alcohol on an empty stomach, it can lower your blood sugar. So important to know about that. And then once you are needing to treat it, this is how you would treat it. So you'd look at 15 to 20 grams of carbohydrate. That's a small glass of juice, not a 20-ounce bottle. Small glass of juice, a small glass of regular pop or soda, or glucose tablets, it'd be 4 of those, or some not hard candy because that's hard to chew, soft candies like gummy bears or fruits that you can just chew down really quickly. So if you're somewhere where they have access to juice or some soda, just take a small glass, drink it down, and then sit down and wait. I always was interested to talk to patients who said, well, I just kept doing what I was doing. You need to wait and give your body time for that blood sugar to do what? Come back up, exactly. So that's the kind of treatment for that. And as I said earlier, your A1C really compares or is matched to your blood sugars. So if you're looking at it having an A1C of less than 7 or 8, you can see the average blood sugar that corresponds to. Once you get up to double digits or over 9%, that becomes a pretty high average blood sugar, so that's not recommended. Okay, and you also have a little brochure, if I can use yours, on understanding your A1C. Again, if you think about it as a memory test, it's looking back at approximately the last 90 days of your blood sugars and gives you an average that's expressed as a percent. So it can kind of give us a picture of where you've been, but your daily blood sugar pokes, the tests, tell us what's going on with you day to day. Where do you have trouble with highs or lows? And that's very valuable information for your provider, your doctor. So what are the parts of a diabetes care plan? Usually at this point, someone will say absolutely food, right? Food is a big part of what I do. A food plan is an important part of your overall diabetes therapy, along with a physical activity plan, because we know that physical activity does what? What does it do to your blood sugar? Lowers it. So it is very low cost and very effective. If you can do about 15 to 30 minutes several times a week, 15 minutes every day, even when you're sitting watching the news, grab those soup cans, you're sitting, or do some leg lifts, do something, because all of the physical activity that you do helps to use up glucose, and it lowers your blood sugar. So it's a very good thing, right? It's a very good thing. A diabetes medicine plan. My partner Karen Locke and I work for Novo Nordisk, and we hear oftentimes patients saying, I just am going to put the brakes on. I don't want to take any medication. I just want to do this naturally. And I always say to them, okay, that's a really good idea, because having healthy eating habits, you can lay those down over your whole life, right? Over your whole life. Healthy eating habits through my 20s, 30s, 40s, 50s, 60s, and beyond. Medicine, diabetes medicines will help you today to lower your blood sugars. When you have type 2 diabetes, remember that's the type that's the most prevalent? 9 out of every 10 people who walk through the clinic doors and have diabetes have type 2, 90%. But it also is a progressive disease. What that means is that over time, your medicine needs change. So way over here, before you got diabetes, everything was working. There is no reset button to get back there once you're over here after 10 or 15 years with diabetes. You never get to hit the reset button and go back to those normal levels. So medicines help with what you no longer have enough of or working well enough. And that's really important to hear, because sometimes people feel, we work a lot with, or I used to with patients that would say, gosh, if only I'd worked harder on my diet, I wouldn't need to take this medicine. If only. And you must know that it's not your fault. It's just the progressive nature of the condition that you have, or that people have, type 2 diabetes. It requires that you will probably have a medication change, and many people will end up on insulin because it's progressive. It is not your fault. It's just the way that the disease works. Okay? Because there is no reset button to go back over here to when things were good and at the right levels. And then a schedule for health checkups. So let's talk about everyone's favorite topic.
Food.
Food, yes, food. Okay, the basics of healthy eating. What does that mean? What does that mean? I think it means different things to everybody, right? Some people will say, well, I have heart disease, so I also need to choose things that are heart healthy. Did you know that when you have diabetes, type 2 diabetes, you are at 2 to 4 times, you're 2 to 4 times as likely, you have a 2 to 4 times increase in the risk for heart disease. So right from the get-go, it's important for people to choose healthful fats and choose lean meats. You see all the foods here on the picture. I'm going to give you an easy method for you to make healthy choices every day. We're going to come back to the label, and we want to start here with Create Your Plate. How many people have heard of that? The Create Your Plate? Yep. USDA.gov. All right. So when you look at creating a plate, it's very easy. I'm going to be the plate. So first, what are we going to do? Divide it in half. Then we take the plate that's divided in half and we divide half of that again. So now we have 3 sections. Into the big section, put non-starchy veg. And no, it does not need to be salad. I had a patient once that said to me, I hate salad, Karen. Do I have to eat that? All the pictures show salad. No, you don't have to eat salad. Perhaps you like broccoli or cauliflower or green beans or asparagus or peppers or something like that. Go for it. So you know you don't have to eat salad greens or rabbit food. But make half your plate non-starchy vegetables. So give yourself a couple of big spoonfuls. Then in the other half, where you divided it in half, the top half will be protein, your meat, chicken, turkey, fish, hamburger, whatever it is. The bottom half will be what? Starch, a carbohydrate, a baked potato, rice, pasta, maybe a starchy vegetable like corn or peas. Add a fruit and a milk, you're done. This is easy peasy. You can do this anywhere. You can be traveling in Italy. You can be, although the pasta might be a little tough for you to put into the small part of your plate, but you can do this anywhere in the world. You don't have to say, oh my gosh, I forgot my measuring cups. You don't need your measuring cups. You want to just try and use the plate method, and you'll be most of the way there if you use that. So it is very straightforward. It's not complicated. And yes, you can certainly do more with portion control, with carbohydrate counting. Today we're not going to go into that in much detail, but the plate method is really a good starting point, a good foundation for most people with type 2. How many, have you ever heard of it? So do you use it at all? Anybody? Try to? Okay. And then portion control made simple. This is very simple because this is always with you. You never leave home without it. Your hand. A fist is about a cup's worth. No, yes, I know. There's football players' fists, and there's the little petite woman's fist. But an average portion of an average fist is about 1 cup. That's a great thing to look at. So when you are out in the restaurant and they set that plate down and it's got 3 fists worth of mashed potatoes, what are you going to do? Okay, you have to stay after for some extra help. You want to try and take a look at that and say, all right, I probably don't need to eat all of this, right? Right. So this is about 1 cup. Where do we live? We are in the Midwest. This is home of what? Hot dish. This is hot dish land. When I go to other parts of the country, they're like, what are you talking about? Hot dish. So most of the time, we could easily fill our plate with 3 cups or more of casserole, hot dish. So try to think about the meat and the starch, those divided parts of the plate, as being together for hot dish. You know, so maybe cup and a half, not 3 cups. And then put the veg on the other half. That's a much better plan than just piling it up and eating 3 or 4 cups of hot dish, because that's a lot of carbohydrate at one time. Okay? And remember what that does. It's not that carbohydrate is not bad. That's not the bad guy. Most of us, though, eat a little more of it than we should. So just trying to whittle down the portions a tiny bit. The palm of your hand, you've heard of this 1,000 times. That's about 3 ounces. So 2 palms of your hand or 4 palms of your hand would be a really big steak. So try to whittle it down to 1.5 palms. And then your thumb is about 1 ounce. So that's a good idea for things like salad dressing or cheese, something like that. Okay? So portion control made simple. If it's more complex, it's going to be harder to follow it, isn't it? We want it to be straightforward, something that you can remember when I'm not there. You want this to be able to work for you. So that's plain and simple in looking at the food management or the nutrition management. We also have to pay attention to the types of carbohydrates. So we said that carbohydrate raises the blood sugar, right? And that's all of them. So the complex carbohydrates like starches and grains, as well as the simple carbohydrates like fruit, juices, and milk. Remember the milk sugar or lactose. So those are all foods that are carbohydrate that raise your blood sugar, as well as everyone's favorite chocolate chip cookies. Okay? I'm a big believer as a dietitian and a diabetes educator that all foods can fit. So think about the upcoming holiday. A couple bites of this or that is not going to be a big deal, but a whole basket is. You know what I'm talking about, those chocolate bunny eggs. So at any rate, just trying to have some normalcy with that. Protein-rich foods are good for growth and repair of tissue. So you need lean meats, lean proteins, meat, poultry, fish, dairy, and eggs. And then fats, we want to try to shift over and be using ones that are unsaturated, which are better for your heart. So monounsaturated fats, things like olive oil, polyunsaturated fats, corn oil, safflower oil. And then trans fats, we don't see a lot of those. They're still in products, but much, much less. They're fats that have been chemically altered. They're a little more shelf stable, and they do raise cholesterol. So for a few years ago, there was a big push to get rid of trans fats. You saw these graham crackers no longer have trans fats in them. And it was just a fat that they chemically altered to make it more shelf stable, so you could buy it off the grocery shelf. It's mostly processed and convenience foods. So if you stay away from some of that, you'll probably be able to avoid trans fats. And then finishing up, let's move. Remember I said earlier, what does this do to my blood sugar? Lowers it every day, every way. So looking at some type of activity every day to help you control your blood sugar. It doesn't have to be fancy. It doesn't have to be, I want you out there as a marathon runner. No way. But something that you can do that you enjoy. You should enjoy physical activity. Perhaps some yoga or Tai Chi or something that will help you with strength and balance. Did you know that as we get older, what do we lose?
Balance.
Balance. So anything that can help you, maintain a little bit better balance is a very good thing. Senior yoga or chair yoga, I think Melissa was saying that you guys have chair yoga here? You had a class on it, okay. So things like that can help you foster and enhance your balance as you get older so that you don't slip, trip, and fall and break a hip. That's a good thing, right? So try to do something at least, we talk about 150 minutes each week, so divide that up, maybe 30 minutes a day, and you can even divide that up, 15 minutes in the morning, 15 minutes after supper. Easy. So the 3 steps that you want to use to be more active would be step 1. Who do you have to talk to first? You want to talk to your doctor in case they say, you shouldn't do this because of this with your health. So talk with your doctor first. Just make sure that it's okay to start something. Step 2, choose something you enjoy or love to do. Even if you have to learn it, start out small and then gradually build up. And then step 3, set a goal, because a plan without a goal is just empty words. If you say, I want to use a SMART goal, it should be specific and measurable. So you say, I want to start doing some chair yoga. I'll do it 3 times a week for 15 minutes. And then at the end of the week, hold yourself accountable. Did you do it? Or I want to walk out to the end of the mailbox, to the end of the driveway to the mailbox every day. It's about, for some of you that live in the country, it might be 3 blocks. So try to do something that's measurable, that you can say, I want to do this much, this many days a week, and make it very measurable, and then hold yourself accountable. Or talk to a friend and hold each other accountable. That's even better. That's even better. Because remember, activity helps to lower your blood sugar. And then finally, we want to keep track of something called your ABCs. For people with diabetes, this is A1C for A, blood pressure for B, and cholesterol for C. The reason why we are looking at these 3 things is because they will really help keep you healthy. People with diabetes, one of the risks or one of the long-term changes that can happen is changes to your small blood vessels. Okay? So that's why when we talk about going in and having a foot exam, it's important that you get that done every year, because those small blood vessel changes can affect how your body is working. So your diabetes care schedule, when we talk about when should I go in? Every 3 months if your blood sugars aren't at goal. If your doctor says, you know, John, Mary, Matilda, we need to get your A1C down, it's too high, then you should be seeing your provider, and these are again based upon the American Diabetes Association guidelines, every 3 months. They do a weight, they check your blood pressure, they look at your feet quickly, it's not a full-blown exam, and they assess your medication. Maybe you need another medication, maybe you need insulin, maybe it's time. Remember we said type 2 is progressive, which means it doesn't stay the same. Over time it changes, and your need for medication may also change. Every 6 months, if your numbers are at goal, if your doctor says, good job, Mary, John, Matilda. If he says, good job, then at 6 months you need an A1C test and a dental exam. People with diabetes that is uncontrolled have more problems with their gums and their teeth. And then every year, and some of this should resonate if you're seeing your doctor, every year you want to have a physical exam, a comprehensive foot exam where your shoes and socks are off, they're testing all your pulses, they're looking at your feet, they're referring you if you have trouble, and it should be more frequent if you're having some trouble with your feet. But that's very important so that, you know, remember we talked about some of the symptoms of high blood sugar, that numbness that can happen. If you can't feel the tack that's in your shoe, that is not going to be a good thing if you stick your foot in your shoe, right? So again, it's so important to be paying attention and to be making sure that your blood sugars are as good as you can get them, because again, you're worth it. All right, and then they will also do a lab test for cholesterol and your kidneys, and then finally they will do a dilated eye exam. Now that's not usually at your doctor's office, you have to go see the ophthalmologist, but he's going to be looking at the vessels behind your eyes to make sure they're healthy annually, or more often if you're having trouble. So kind of wrapping that up, that's a lot of stuff, but we know that people with diabetes can live very healthy lives. We have more and more people in this country with diabetes, so it makes sense that we would take the bull by the horns and just do it. Just do it. So I would be happy to entertain any questions. You know, we talked about taking charge of your health. What questions do you have for me about diabetes? Yes?
You didn't address neuropathy, but does that come from either type?
Neuropathy is a complication that can occur with high blood sugars over time. It's not something that happens in a day, it's over time. And that is that numbness or tingling that can occur. And pain, yes, and pain. So again, what would be the part of the solution for that, besides taking the medications that they prescribe for the pain,
Oh, wow, yeah.
but also controlling your blood sugars, right?
You bypass the labels. You were looking at.
Oh, yes. Very good. So let's go back to, everybody goes to shop in the grocery stores, right? Most of you? All right, so here we have a nutrition facts label. The label has changed a little bit. They've bolded now the calories. They've bolded the calories and the serving size. You know why? Because people used to say, well, Karen, I ate a bag of chips. Nobody looked to see that it was 5 servings for the whole bag of chips. So they wanted to make sure that you saw that that calorie level was bolded, and then what is the serving size? Not the whole bag. So on a label, there's a couple of things that people with diabetes should look at, okay, or be more aware of. And I'll show you what they are. If you can see this, so when we talked before about what affects your blood sugar the most, what affects your blood sugar the most? Carbohydrate. So you want to scroll all the way down to this, the total carbohydrate, okay? So we see the serving size is 2/3 of a cup. It gives us 230 calories. All this information that follows is based upon that much. If you eat 3 times that much, you have to triple this, right? So total carbohydrate it's 37 grams. Well, what does that mean? That doesn't mean anything. Unless you know the golden rule, The golden rule is that every serving or portion of carbohydrate is equal to 15 grams. 15 grams of carbohydrate is always one serving, okay? Doesn't matter where it came from, that's one serving. So if on the label it says a serving is 37 grams, diabetes is a math game. You guys know that, right? Diabetes is all about math. So we say 15, 30, and then half again as much. So it's about 2.5 servings of carbohydrate. You always count by 15. So let me ask you this. This is for 10 points and a chance to leave early. If I'm going to go to Panera, we all know Panera down in St. Cloud, and have one of those big old bagels. They are delish. Okay, and I look up the nutrition facts, and it says one bagel, is 64 grams of carbohydrate. What are you all going to tell me? So again, cut it in half. That's a good suggestion. But just think through the math. So if one serving is 15, 64 is 15, 30, 45, 60, and a little bit. So it's at least 4 servings. It's the same if you eat that bagel as eating 4 slices of toast. So quantity, or the big muffins the big muffins at Sam's Club. And I'm not pointing these out to say don't ever eat them. I'm just wanting you to be aware that portion size really, really matters. So a small blueberry muffin for 23 grams or 28 grams of carbohydrate, which is about 2, right? 15, 30, it's right there, is much different than a big old blueberry muffin that's 65 or 85. So when people say, I just had a muffin for breakfast, I want to know, what did it look like? Right? What did it look like? So at any rate, that's a little bit about nutrition facts. Now there's certainly lots of other information on the label: sodium, fat, fiber. Fiber, again, foods that are high in fiber help you to feel fuller. So that's a good dieting trick that actually works. You will feel fuller if you're eating more fiber, and you may not be as inclined to go back for seconds and thirds and beyond. So that's a good thing. But carbohydrate is kind of what we look at most when we're talking about diabetes. And if you're using a food plan that has a certain amount of carbohydrates spread throughout the day, this will help you to know, how do I look at those labels and what do I do? Okay?
So how does sugar affect that?
Okay, good question. What about sugar? When you look at the sugar amount in a food, that is wrapped into the total carbohydrate. Okay, so that is part of the total. They met it out. They look at having it as its own number for added sugar to that product. So anything that's got added sugar or molasses or honey, that'll go in that sugar column. But, and this is where it gets tricky, sugar also refers to natural sugars. So on a bag of fruit, the sugar number will be high because it's relating to fruit sugar, right. Same with milk. I used to have patients that would stop drinking milk because they said to me, do you know how much sugar is in milk? That's relating to the lactose because that's what's in the sugar number. So really, you don't need to look at that as carefully as you do the whole total carbohydrate.
What about the dry?
What's an ideal plan for carbohydrates?
Yeah, what's an ideal plan? The answer is there isn't one. In general, though, you heard me say the carbohydrate is necessary so you can get up and go, right? So you can get up and leave today and drive home and all of those things, do your activities of the day. So it's not appropriate to suck it all out of your meal plan or not eat any. On the flip side, it's also important that you don't have 10 or 12 servings at each meal. That's too much. So there isn't really one perfect answer, but somewhere in the neighborhood of 3 to 5 per meal, just depending upon whether you're male or female, large or small, active or not, is kind of what you would be looking at with most diabetes educators. But again, I don't want to give everyone just a blanket recommendation. Just know that it's important not to take it all out, and it's important not to have too much. Spreading it out throughout the day is probably the name of the game for most patients with type 2 diabetes based upon your medications. You can't save it all up and have it all at dinner.
Would you recommend the use of sugar substitutes like Equal?
Would I recommend the use of sugar substitutes? In this country, sugar substitutes have been studied extensively, years and years and years. And so they are recognized as safe in this country, and I would concur with that. For you to say, I don't want to use that, I would rather use sugar, I couldn't agree with that. Maybe don't use anything if you don't want to use them. Or use a natural sweetener, you'll have to count because that provides calories and carb. All right, yes, last question.
My doctor just told me that not to drink diet pop, to drink regular pop. He said the best thing not to drink no pop. But if you're gonna drink pop, drink regular pop.
Can you tell me who that is? No, I'm just kidding. He needs to have a talk with his dietitian. Regular soda has somewhere in the neighborhood of 11 to 13 teaspoons per can of sugar. Now, that would not be recommended for really anybody with diabetes unless what? When would you have regular soda? Low blood sugar, that would be the time to have that. But otherwise, that is a boatload of sugar for your body to have to handle. And I would prefer, as would every diabetes educator, that you get that carbohydrate from healthier foods and not from soda. So
between the two of them, he said the best is none. Between the two of them, what are you saying then?
well, diet soda would have 0 carbohydrate. Regular soda would have 48 grams or 52 grams.
Why did he say that?
Don't know.
Because he said that stuff they put in for the substitute in diet pop is more harmful to you than.
Yeah. Do you know, there have been a lot of research studies, and that's what I'll just close with, is that you can go on the internet and find anything about anything. You know, people can say that it was a medical this or that, or they're a medical person. You don't know that. You don't know their credentials. You don't know where they came from. Scientific, evidence-based research with large numbers of people, those are the kinds of studies that you want to look at or make some determinations about whether or not you're going to use it. And so for artificial sweeteners, which have been studied in people for years and years and years with large numbers, they're recognized as safe in this country. And, you know, not to go down the rabbit hole with this, but evidence-based practice with large numbers of people where they studied it, the kinds of studies that we do when medications are approved in this country, that's what you really want to look at. You don't want to just Google something and say, well, I see that this cures diabetes, because we know those aren't true, right? We know that. Thank you, everyone. I really appreciate your questions and your time.